The gentleman from Delaware is recognized for 4 minutes.
Thank you, Mr. Speaker. Last week when I was back home in my district in Delaware, getting a workout at the YMCA in my hometown of Wilmington, a man came up to me as I was on the exercise bike and said, "Excuse me, do you mind if I interrupt?" I said, "Of course not, I work for you." He said, "I wanted to see if you know about the status of HR 4414, because I write expatriate health insurance plans for Cigna, and I don't want to lose my job. Losing even one job like this in my state keeps me up at night. The prospect of losing 500 jobs is a punch to the gut. That's how many jobs we'll lose in my home state of Delaware if we don't pass this bill on the floor today. I'm a strong supporter of the Affordable Care Act. So are a lot of people in my state. But no law is perfect, and in a law as important, as complicated, and as technical as the Affordable Care Act, there are bound to be a few things that needed to be fixed. The ACA was unintentionally written in a way that subjects U.S. expatriate health insurance plans to all the provisions of the ACA, which places a unique burden on these types of plans. Expatriate health insurance plans offer a high-end, robust coverage to people working outside their home country, giving them access to a global network of healthcare providers. Individuals on the plan could be foreign employees working here in America, Americans working abroad, or say a German working in France. Expatriate plans ensure that these employees have worldwide access to quality health care while working outside their home country. Several U.S. health insurance companies, Cigna, MetLife, Aetna, and United Health, offer expatriate health insurance plans. These insurance companies compete with foreign insurance companies that also sell the same kind of plans. The issue is these foreign plans don't have to comply with the ACA. Forcing U.S. expatriate insurance plans to comply with the ACA thereby gives their foreign competitors a distinct advantage. As a result, to stay competitive, a U.S. expatriate insurer will move their business overseas, taking the jobs with them, and that's why I'm here on the floor today. The good news is that we have bipartisan legislation here today that will level the playing field. In fact, the administration has already provided temporary relief for expatriate plans from nearly every Affordable Care Act provision that's gone into effect so far. The problem is this relief is only partial and only temporary. The administration can't make this relief without this legislative fix. Our legislation ensures that American expatriate insurance carriers are on a level playing field with their foreign competitors so that American jobs stay here in America. Many of you know that this is our second go-round at this legislation. Over the past few weeks, we've worked painstakingly to improve our bill, and we have. We're confident that our original version of the bill wouldn't have negatively impacted green card holders or create loopholes in the ACA, but we've worked hard over the past few weeks to address the concerns we heard. We heard concerns the bill would let insurance companies create low-quality plans. Our bill now requires expat plans to meet the same value standard as any other employer-based plan under the ACA. And if the plan doesn't meet that standard, then the expat can use subsidies to buy coverage on the exchange, just like any other American. We heard concerns that the definition of an expat was too broad, that it would be taken care of. We changed that definition, tightened it up, and it's identical to the HHS regulations today. We now make explicit that expat plans must follow all ERISA and public health service requirements that were in place before the ACA. We've been working on this issue for 3 years. The crafting of this bill has been a more collaborative, bipartisan process than I think this chamber has seen in quite a while. And I want to thank my friends and colleagues on both sides of the aisle for that effort. This bill isn't perfect. The Affordable Care Act wasn't perfect. No bill is perfect. But if there was ever a case where the perfect was being made the enemy of the good, we're hearing it from my colleagues today.
Expired.
Additional minute.
The gentleman's recognized for an additional minute.
And so if we don't pass this legislation today, people who have expatriate plans and the companies that offer them will continue to do so. The question is whether they'll do so here in the United States and keeping those workers here, or whether they'll move those operations overseas. I understand as well as anyone that the ACA is a political weapon in a larger political war on both sides of the aisle. All I'm asking today is that we take action so that 500 hardworking Americans in my district don't become collateral damage in that partisan political fight. Let's call a temporary truce in that battle today to protect those jobs. Finally, I want to thank my colleague, Congressman Nunez, and the Ways and Means staff on both sides of the aisle for their hard work on this issue. And I want to thank leadership on both sides of the aisle for recognizing this is a very serious problem that needs fixing. I ask my colleagues on both sides of the aisle to support us and vote yes on this legislation today. Vote yes on H.R. 4414. Thank you. I yield back.